Freedom, Oregon. We have two wonderful guests on a special theme today. I'm David Oakes, working with Mind Freedom Oregon, and our topic is something I've thought about for years and really hoped we'd address, which is getting lived experience to alternatives to police intervention. My wonderful wife, Deborah, is here and can repeat me.
Okay.
So, Mind Freedom International.
Mind Freedom International.
Yes, really hoped to have more input.
Has really hoped to have more input
For mental health consumers.
For mental health consumers.
And psych survivors.
And psych survivors.
For alternatives like Cahoots.
Or alternatives like Cahoots.
Which is, you hopefully know by now.
Which you hopefully know by now.
And often, in fact, this Sunday, I was there when our church used Cahoots.
In fact, I was there this Sunday when our church used Cahoots.
We had a distressed homeless woman.
We had a distressed homeless woman.
And the minister tried to work with her for an hour.
And our minister tried to work with her for an hour.
And a Whitebird Cahoots van showed up with two folks.
And a Whitebird Cahoots van showed up with two folks.
And they very compassionately, but, carefully.
And they very compassionately, but, very carefully.
Addressed the distressed woman.
Addressed the distressed woman.
And I was able to talk with her.
And I was able to talk with her.
Jenny.
She
told me.
And
I introduced
myself.
So, we hope to have more lived experience.
So we hope to have more lived experience.
And peer support. Be a more intentional priority in Mind Freedom.
Priority with Mind Freedom.
Cahoots has always supported empowerment.
So Cahoots has always supported empowerment.
But principles like peer support and empowerment.
But principles like peer support and empowerment
are more like happy accidents. We did a panel with Cahoots folks. And most had lived experience. But I can happy accident.
By a happy accident.
So without further ado.
Let
me introduce. The two folks today. Kelly Williamson. Is with Mind Freedom International. On the staff. Kelly, would you like to introduce yourself?
Kelly, would you like to introduce yourself?
Sure. Okay, so there are three of us on staff right now at Mind Freedom International. Ron Bassman, who's our executive director, he is in Boulder. So he works remotely from Colorado. And then Sarah Smith and I are in and out of the Eugene office. Sarah focuses more on development. And gosh, she does a lot of the more operational things for the office. And I focus more on incoming calls, communicating with volunteers and members and things like that. So that's what I'm doing now. And I also facilitate Hearing Voices groups within this community, which is one of my favorite things. So I'll just say that. Nice to see everyone.
And our other guest today
And there are other guests today.
is a very special guest.
There's a very special guest also.
Laura, how do you pronounce your last name, Laura?
Laurel, how do you pronounce your last name, Laurel?
Lisavskis.
Laura is a crisis worker,
Laurel is a crisis worker
clinical coordinator
And-
for Cahoots
and clinical coordinator for the Cahoots team.
facilitated the new stewardship council.
And facilitated the new stewardship council.
She is facilitating
She has facilitated it
right now,
right now.
and we'll hear more of that in a moment.
And we'll hear more about that in a moment.
So, Kelly and Laura, thank you so much.
So Kelly and Laurel, thank you so much.
Take it away.
Take it away.
I wonder, Laurel, I'm happy to start with just what we did back in January. And then how do you feel about that?
That sounds great.
Okay, sounds good. Thank you. So at the end of January, Mind Freedom International had been having meetings for the last, well, in January, we hosted a training with Mind Freedom International and Cahoots and Whitebird staff. And this was specific to just giving some information from psychiatric survivors. And the training was called Through a Survivor's Lens. And while we know so many people really appreciate what Cahoots does in terms of compassionate communication and de-escalation, on the ground, we felt like there was this other piece we could go deeper into in terms of direct feedback from individuals who have been harmed in certain systems, specifically through within psychiatry, or maybe in other ways too. I think everyone had their own story. So in late January, we hosted an online training. There were 3 presenters at that training. Laura Van Tosh, who identifies as a psychiatric survivor. She has been really active in issues around consumer affairs and mental health policy. And who else was at this? Let's see, Vesper Moore. He's a board member for Mind Freedom International. He also, so all of these presenters identify as survivors, individuals who have encountered harm within these systems. And Drake Eubank he was another presenter. He's been instrumental in creating trainings for peer support specialists through the state of Oregon. I'm sorry, I'm just going to put you on hold for just 1 second. Sorry. Okay, I'm sorry. I'm at home, so I'm juggling a little, just honest. Okay. So Laura Van Tosh, Vesper Moore, Drake Eubank were 3 of our presenters. And I guess I just want to say out loud that this video is recorded. So anyone here who wants to view that can do so. You can get in touch with me and I can pass that along. Let's see. And I guess, so the purpose of that, it was 2 hours where we came together and just really created space where individuals could share their stories and give feedback for, Cahoots and Whitebird staff members. And it was one thing also that was really inspiring for me was to learn that, so because of an increased budget, diversity budget, we were able to, or Whitebird actually supported these presenters, and these presenters received small stipends for their time, which I also felt was a really good, just positive acknowledgement. Does anyone have any questions so far? And if you send me a direct message, I'm happy to share that link with you. But maybe I'll just be quiet for a moment to see if anyone has questions about that event that happened in late January.
Hi, Kelly, it's so good to see you here. I have a question about how many people attended, and did you say about how long it was?
Sure. So it was 2 hours long, and we were under 30 in attendance. I want to say we had about 24 people there. I could get an exact number. I should know that. Yeah. Thanks, John. Any other questions about the event?
Yes, I have a question. How did it come about?
Sure. So from what I understand, David, correct me if I'm wrong, but David has been working for some years just to try to strengthen that partnership with Whitebird and Cahoots and to get, you know, survivors at the front of that experience in terms of feedback, in terms of the work that Cahoots and Whitebird are creating and practicing. So I think I'll just say that it started many years ago with David. And before COVID, there was a member of Whitebird who had been there for some years, and he and I had started conversations. It took about 1.5 years, I think, on and off for us to meet and go back and forth and see what might work best.
Kelly,
Yeah.
you're too generous.
Oh, Kelly, you're too generous.
I'd say for over the years, like decades.
I'd say for like over the years, decades,
Oh.
actually.
We've brought up issues with Whitebird.
We brought up issues with Whitebird.
Vic, Deborah, I even had couples counseling there.
In fact, Deborah and I even had couples counseling there.
But my impression was that Whitebird was often too busy doing crisis work.
But my impression was Whitebird was often too busy doing crisis work.
So Mind Freedom Oregon has continued to bring up the interest, and I hope positively,
And so Mind Freedom has continued to bring up the interest, and I hope positively,
especially Mind Freedom Oregon.
especially Mind Freedom Oregon.
But really, Ron Bassman and you and Ron Unger and Drake and Laura Ventosh and others have really connected. But I'm extremely eager to hear from our special guests. Is this a good time, Kelly?
That sounds great. Yeah, thank you for being here, Laurel.
I hope our bingo has been positive.
You said, I hope our bugging you has been positive, Laurel.
Oh, absolutely. Yeah, I was actually trying to think of how I got connected with Kelly. I think a person in another department CC'd me on an email. And I was like really excited to hear that a connection was possible. It is true that we are always really strapped for people, and time is really precious, but the most important feedback we get is from community members. And as a clinical supervisor, I often field phone calls and work with folks who want to follow up on experiences they've had with Cahoots. And that is like how good change occurs within our team, is to get that critical feedback and to directly deliver it to the people that are out in the field doing that work. So to me, this felt like a no-brainer. Of course, we should meet and talk, and we felt really honored and lucky to be able to have that experience where we were hearing from folks. I do see a hand from Barb.
Yeah, I'm just curious. I'm in Portland. So does that mean that Whitebird and Cahoots, neither of them have a consumer advisory group attached to them?
Whitebird Clinic has a board, and on that board,
A board isn't an advisory council.
right, yeah, no. So Whitebird Clinic has a board. Cahoots has a stewardship council, and that's sort of like one of the things that I wanted to talk about here today. We didn't have any such thing for many years. And about 2 years ago, we recognized that that was not a good way to do work. And so we did start a stewardship council. And we've been meeting for, yeah, like I said, 2 years now, and trying to formulate the best way that we can hear from community and work together. And that is like one of the topics for today's conversation.
Go ahead, Laura. Tell us what you wish.
Okay. So I'm hoping that folks have heard of Cahoots. Does it feel good to like give an overview of the work we do? Maybe just like a quick background. We're a mobile crisis service. We've been around about 30 years. It started between Whitebird Clinic, speaking with Beat Police, and then working with the Eugene Police Department to create a partnership where folks with mental health education and background and folks with medical skills could be responders as opposed to police because of the nature of the calls that were happening. It just didn't seem appropriate for police. And so we've grown over time. We expanded into our sister city, Springfield. We have a van there 24 hours a day. And in Eugene, we have a couple of vans running, one van running 24 hours and one running from 11 a.m. to 11 p.m. And they're still made up of folks who have a couple of years of experience working with people in crisis or have a basic EMT. That's like the like lowest amount of medical experience someone needs to join and train with us. We come from a position of, you know, folks are the experts on their own lives, and we're just here working with people in order to get them to access their internal supports, kind of identify their external supports, and sort of help someone who's maybe really escalated come to a place where they can access for themselves the plan that might help them in that moment. And then where there are gaps, we try to fill those gaps with we reflect what the community can offer. So we try to be aware of the things that are available for folks in the community. And through that work, we often, our goal is always to divert people from jail, to divert people from the hospital. But we do recognize that we're absolutely a part of that institutional trauma for people. Sometimes we do transport people to the hospital. We do come into people's lives and spaces when there are a lot of barriers for them to like get any of the things they need to feel centered, to feel supported. And so we are a part of the system. Certainly we're paid for out of the police budget. We recognize that. We also recognize that we can't always be available to folks. We know a lot of people can't access our services, don't feel safe or comfortable contacting the police department. And so those are the folks that we really wanted to hear from when we developed the Stewardship Council. And I'm going to look at a couple of notes while I'm talking, just because I don't want to forget all the things. Some of the intentions that we set with this council were around like building relationship with folks. We wanted to seek input on what education our team members need in order to be relevant and aware on all the different calls that we go on. We wanted to share with community members the work we were doing with the ad hoc council on the Police Accountability Committee for the CSI budget, which is a pool of money that the police department in part was going to be receiving, and in response to George Floyd's murder. A lot of conversations were happening, and we wanted to share whatever input we could, and we wanted to provide input to those councils that represented and reflected the community that we were working with. We also wanted to hear spaces where we could be more useful, more accessible. So we did some bilingual outreach based on the folks on the Stewardship Council's advice. We have about 16 people on our team that are currently learning Spanish, and we did some translations and went into Springfield, where we've only been for like 5 years, and tried to make more relationship, and that is ongoing. We made changes to our documentation practices, things that probably feel like a no-brainer to some folks, weren't to us, and we got feedback around how we write our assessments. You know, we keep records on our team of encounters that we go on. Those are HIPAA protected private records, but folks can request their records and do so for a number of reasons. And we recognized, we got the feedback that like putting people's diagnoses down that are just information that we've learned on a call and not necessarily how someone identifies for themselves was completely inappropriate. So we stopped immediately doing that. Just that like really good pieces of information that we can get from folks who are willing to work with us was sort of the goal. And we're doing some shifting with our council. Some folks are leaving, some people have moved, and we'd like to expand our Stewardship Council to include some more interested people. And so I really did want to like bring that here and see if there are people who might be interested in helping us do this work. We definitely compensate. We have $100 Visa gift cards that we are able to share with folks who can participate in our council. That feels, really important. Our Stewardship Council folks have done trainings with us, and we pay $500 a piece for those trainings. We had an excellent one from Mark Harris on medical microresistance that felt really important. So all of the information that we're getting from our Stewardship Council members are really like central to the work that we do. So we want to value and prioritize it. Having said that, we haven't had one before. The Cahoots administration team is relatively new. We've had like a changing of the guard, and we've only been working in these administrative roles for a year and a half, 2 years. So we're really open to like suggestions. We are looking for structure. Not a lot of us have management backgrounds. I'm a social worker. I got my license last April. I have been on the Cahoots team since 2015, working in lots of different capacities, kind of a little bit ragged style like most of us do, trying to keep the vans on the road, and that is always our priority. But what we do when we show up and how we show up is the most important thing. So it does make a lot of sense for us to communicate with people who confidently or unconfidently try to get a hold of us, and we want to be really careful about the work that we do. So this feels like a priority for us. I guess I'll pause for a second and just see if anybody has questions. I know I just said a lot of stuff. David said it best. A lot of us have lived experience, but it is by happy accident. So no, we don't have like a formal peer support process for the Cahoots team yet.
How much are you in touch with clients after that initial contact?
How much are you in contact with clients after that initial contact?
We don't have formal follow-up with our clients. we're considered crisis response, and our dispatch sends us on crisis calls. And because dispatch dictates where we go, there is a code you can use, code 6, to follow up on a call, but that in practice, if we were to expand, would be a super lovely thing to be able to provide for folks. And right now, we don't have the number of staff to be able to do that.
So remember to raise your hands.
So remember to raise your hand.
Laurel, if people want to be on the council, what should they do?
So Laurel, if people want to be on the council, what should they do?
I would love to take people's contact information, and then I'll reach out by email as soon as we have our next council meeting in about 60 days. And at that time, we'll figure out the number of folks that we need. And I would love to be able to just follow up next week and say hello and build relationship with folks who are interested in that. And we'll have ongoing conversations.
Do you know how to copy a chat, some chat, 3 dots? Okay, so if folks want to put their contact info into chat,
So if folks want to put their contact info into chat,
and yeah, of course, you have to say that toward the end,
of course, you have to save that toward the end.
because, yeah, you know,
'Cause
good. Okay, so what's the next question? I have a question myself, which is, you all have been in the international spotlight,
So I have a question too. You all have been in the international spotlight.
like Toronto has been wanting to build one,
Like Toronto has been wanting to
Many
build
places.
one in many places.
Oakland,
Oakland, Denver,
you name it.
you name it.
Nationally, there's interest.
So nationally, there's interest.
Statewide.
Statewide.
So how have you connected with those other models?
So how have you connected with those other models?
Yeah, a lot of conversations have been happening. We got pretty busy contacting lots of different folks, reached out after we sort of got into the spotlight as an alternative to police response that had been around for like 30 years. That was a unique program. And so we were identified as people began to have this conversation. And so we did a lot of talking with lots of different cities. Some projects were started years ago, like Denver STAR program. They've been building for like 5 years, but the majority of people just recently started talking about this model. And there are lots of conversations. Ebony Morgan, she's a Cahoots worker who was serving as our program coordinator, and she went and spoke to the Senate judiciary hearing about police response. It did become a federal mandate, so that, and not even an unfunded one now. I guess the Cahoots Act has passed, and cities are going to be given money in order to provide some type of alternative police response. What that looks like is up for debate in each community. Some people are looking at co-response, which is still a police officer and then like a social worker type together in a police vehicle. Some people are looking at alternatives, like our organization that can arrive instead of police. There's going to be a new like 988 number, a 3-digit number that folks can call for crisis around mental health specifically, kind of as an alternative to having to call 911 or the police non-emergency line. And that's another national rollout in response to this like international desire to have less police and more other kinds of folks who are appropriate to respond to crises that don't involve crime. There's an organization in Portland, a really lovely man named Jason Renaud. He puts on the Oregon Law and Mental Health Conference each year, and he started an organization called the Alternative Mobile Services Association. Sorry, that's a mouthful. Or AMSA. And really super blessed to work closely with that person. We just did a conference in February, early February, where lots of different models came together. This is so exciting for us. It's been a lonely experience up until pretty recently, with people developing out their beautiful ideas. I give a nod to Atlanta's PAD. That's a diversion-based program. They've converted like parts of their jail into homeless shelter. They're working closely with police funds, but instead of police, to try to utilize diversion program funds to help do this work. So there's lots of creative ways to address it, and every community looks different. The American Mobile Services Association creates this space where people can share their beautiful ideas or seek advice. I gave a presentation on supervision, just like how do we work with our crisis workers in order to make sure that people have the information they need and have a good understanding of restorative justice, have an understanding of decolonization of mental health, and like have the relationships built with community members to the best of their abilities to try to make sure that the work we're doing is relevant. So there's lots of different really exciting things happening all over the nation. We have a person who just won a Churchill Fellowship from Australia coming in August, making kind of a tour going to CIT International, which is a crisis intervention training conference, and then over across through Seattle and down to try to spend some time with us as well. So it's really a really exciting time to be doing mobile crisis work.
So we have a question from Kenneth and then Barbara.
So we have a question from Kenneth and then Barbara.
Actually, I have more than one, but I have it in Notepad, so we can go fast. Question one, Laurel, you said you guys take some people to the hospital. How much of a say do they have in that decision?
Thanks for that question. Yeah, we are a consent-based program. We work to develop trust with people. We help them to make decisions that they want to make that make sense for them. So we don't make people do anything. I would say that, like, just to follow that question, there are a couple of instances where we will ask for support if someone isn't. So like if someone is super intoxicated and on a very busy road and we're not able to like have a conversation with them where they understand and see that like it's a very dangerous position that they're in right now, and then we might ask for officers to come, and sometimes just the presence of the officers get folks to say, oh, okay, I guess I should, get out of the road, or sometimes we'll have to give the call over to officers, but we still try to stay there, stay engaged, and re-enter into the conversation as soon as possible for us. So sorry, that's kind of a long answer, but I did want to speak to like the caveat to that consent-based interaction.
My second question is, can I be involved in the Cahoots Stewardship Council remotely from Zoom?
Good question. All of our meetings, since we haven't had our Stewardship Council pre-pandemic, have been remote. So I think, I do feel like we would all love to get together and share time, but it's not safe for everyone yet to do so. So while that is still happening, then remote participation would be super welcome.
If I'm able to join by Zoom, could you please put your professional email in the chat so we could email you with our offers to join?
That's an excellent idea.
Any other questions? Kelly?
Yes, do you also want to know our background when we email you? Anything that we think might be relevant?
That would be wonderful. And I will ask, I will ask questions if folks don't. But I would love to know, yeah, just what kind of voice you're bringing, like what is your background, and the amount of participation you're interested in. We ask for people's time. For the first 6 months, we met monthly, and then we started to meet quarterly. So anywhere between 2 hours a month to 2 hours every 3 months. So it's not a huge amount of time, but I would want to know that that is something you could do. And yeah, if there's anything you're hoping, like if you have an agenda for joining us, that is really important, and I would love to hear that too.
So, Barbara, I want to apologize. From now on, in my mind, you're Barb, B-A-R-B.
So Barb, I want to apologize. From now on in my mind, you're Barb, B-A-R-B.
Go ahead.
Go ahead.
No problem, David. It happens all the time. That's why I learned to put a full stop after my name. I was 45 when I figured that out. But so I'm in Portland, and I have tons of questions. One is, does your police department have ECIT officers, enhanced crisis intervention training team? Yes.
Yes.
Okay, so that's cool. I'm really, what you guys are doing is really great. How we do this? I forgot my second question.
Oh, that's
Come back.
okay. I'll be here until 2.
Yeah, I'm like, Elle
Or
had
longer
their
if you need me. Yeah.
Elle had their hand up, and then it went down, and then it went back up. Oh, they said be right back. Okay, never mind. All right. I'll come back when I remember.
Yeah, Barbara, I should mention was just to check in briefly at the end.
Oh, Barbara, I should mention, well, just to check in briefly at the end.
We usually have more time.
We usually have more time.
But this is important.
But this is important.
Thank you, Kelly, for organizing this.
Thank you, Kelly, for organizing
So
this.
we have about 8 more minutes.
So we have about 8 more minutes.
And there, Chuck, I think I see your hand up.
Chuck, I think I see your hand up.
Yeah, thanks, David. And actually, I think this question originally came from you, David. So thank you again. But I really appreciate the work that Cahoots does. My experiences with Cahoots working in mental health were always very good, and you do this respectful and consent-informed crisis intervention. At the same time, you're a link in a system, and that system has other parts of it that aren't as respectful and aren't as consent-based. How do you feel like the crisis system overall in Lane County is these days? Are there alternatives besides the hospital? And maybe you could just briefly describe some of those. Thanks.
Oh, Chuck, yeah, thank you for that question. I do feel very much like my comrades who I work with have all sort of been watching the infrastructure really crumble. It's been a really intense and difficult time for systems, and systems are failing. And maybe that's been the case for a long time, but just personally, having been on the van for about 5 years, I noticed there are things that shift, but those things have their own set of things, right? So we got and I want to be want to be like diplomatic because we all, you know, have relationships with partner agencies. We work with the police, we work with the hospital, we work with lots of different, you know, we've got Laurel Hill and Shelter Care, lots of different programs and nonprofits that are like beating at the door in their own ways. But those things also feel, you know, understaffed and underfunded. So we have like crisis stabilization center, Hourglass, and they're supposed to be 24 hours. They're not. They haven't been for a long time. They're the last person we're allowed to bring in is like 9 p.m. and they're an alternative to the hospital, right? It's again like a consent-based organization. They don't have medications or secure rooms, you know, some of the things that are really unpleasant about going to the hospital if you don't need to, but you don't feel safe at home or alone. The Hourglass is a really good place to be able to go and talk with folks, but they've been closing early for many months. Hopefully that will change. There's some newer supportive housing like MLK at the Commons. There's another one opening called the Nell on Charnelton, which is supposed to be, you know, for folks who really need a lot of support, folks that are experiencing, you know, some substance dependency, along with having mental health diagnoses, people who have been unhoused for a long time and have been accustomed to self-medicating. And the process of having all of those folks living together is a really fragile, delicate process. I think there needs to be a lot of support in place. And so we've watched that since it's been a little over a year now since that place has opened, and it does seem to be like getting better. We see a lot of our community members that we interact with regularly live over there, and I've heard from them that it's getting to feel more peaceful. But there was a series of evictions for people who are evicted from that environment. It's really difficult to then be able to be, I mean, it's just a count against a person who already has so many counts against them. So there are some really painful, really difficult things about working in our community, in our county. We have some folks that that are siloed out of almost everything, who need almost everything. Like there's a woman I see really frequently. My like least favorite call on the van. She has nowhere to be. She has, you know, a walker. She's in her 70s. She has a lot of behavioral, like it's difficult for her to interact with people. So she has a hard time regulating herself. And I don't literally have anywhere to bring her because there's nowhere for her to go. So these things are really painful and difficult, and it is part of the moral injury for Cahoots workers that we do constantly interact with these aspects of our community. And we all know that everyone could be doing a lot better.
Kenneth, is that your hand up?
Kenneth, is that your hand up?
Yes.
Go ahead.
Go ahead.
Also, this reminds me of the Judy's room that we had on June 1st, where we discussed suicide prevention. We discussed the 988 number in greater detail. The great flaw in it is it's call tracing. So people call that number asking for help, and in 3 to 7% of cases, police show up to hospitalize them. So that being said, I think it's great that almost all of your interactions where you take the person to the hospital are consent-based, and maybe Cahoots can supplement for less severe cases with phone service without tracing.
Yeah, that's really a thoughtful observation. And I think, you know, this is where also policy does play a role, right? So there's like, regulations that dispatch follows when they get information about a person, and safety measures that the community takes because they have to send officers out to calls like that. And so, yeah, if we could change kind of the rules and expectations around what is needed for someone when they are reaching out for that kind of support and what that support looks like specifically, that could probably help enhance. I imagine we're going to see a lot of kinks as we roll out 988. I think it's going to be really interesting.
Right. It's sad because these people are scared, and if there's going to be call tracing, they might also be scared to ask for help.
I just want to quickly mention that Mad in America just wrote up an article about 988, talking about the National Suicide Prevention Lifeline and maybe some issues around this. There's also, I'll just quickly say, I read something on there about a steering committee that was forming, that they're inviting people in with lived experience to give some feedback. So anyway, you can find out. I need to still read the full article, but it's on Mad in America. I think just the most recent one.
Let me ask everybody.
Let me ask everybody,
Can we go a few minutes more?
can we go a few minutes more?
Laurel, are you okay being here a little longer?
Laurel, are you okay being a little longer?
Heck yeah.
Okay, and maybe we can do check-ins next month.
And maybe we can do check-ins next month.
Is that okay,
Is
folks?
that okay, folks?
By the way, yeah, there's someone who uses this a lot who can use support. So contact me about that. But here's a tough question.
Here's a tough question.
You guys do great with non-violent
You guys do great with nonviolent
mental distress.
mental
folks.
distress folks.
Now, my understanding is that if the individual has a weapon or threatens violence,
My
you-
understanding that is that if the individual has a weapon or threatens violence,
you guys have to stand back.
you guys have to
Am I
stand back.
correct?
Am I correct?
And what's a long-term vision for filling that gap?
What's a long-term vision for filling that gap?
Yeah. I mean, it's all very contingent upon the information that is shared by the callers. There may be a chance, this is one of a long way around, but it just makes me excited. One of the things that we talked about in the Stewardship Council was getting dispatchers trained in mental health so we can figure out more robustly, like what kind of support is needed at the location of the crisis. And we can get that from people who have been trained in mental health and understanding what kinds of information that we need to be able to go in. I'm going to knock wood because in 30 plus years, since 1989, no CAHOOTS worker has been like gravely injured on any kind of call. I have definitely been punched in the face a few times, but no one has gone like to the hospital or had to be seen for injuries based on the calls that we've gone on. And if we do go on a call and we see, it's very common to see lots of things can be used as a weapon, and some weapons are, really intentionally weapons. And if we do see, a firearm on a call, we feel very comfortable talking about that weapon, asking for it to be secured while we have a conversation. Things aren't like scary just because there's a weapon around, and things aren't necessarily scary if people are violent. A lot of times anger is the appropriate emotion for the situation. And sometimes that, folks are self-destructive. Sometimes folks are targeting their anger at a particular person. And I think scene safety is a really important piece of this work. It's up there at the top of the triangle of like skills you need. I think that if we had one of the things that we've talked about is engaging in really good some kind of physical defense strategies and techniques so that we can keep ourselves and our patients safe even as things escalate beyond what we feel comfortable with. But yeah, oftentimes, short answer to your question, if the person calls in and if they are describing a lot of violence happening at the scene, we will have to go with police.
Well, thank you, Laura and Kelly, and be sure to capture the chat.
Well, thank you, Laurel and Kelly, and be sure to capture the chat.
Okay, and thank you all for being part of this.
And thank you all for being part of this.
And Mind Freedom International has a campaign right now
And Mind Freedom International has a campaign right now
for support for the SHIELD.
for support
campaign.
for the SHIELD campaign.
So check out their
So
website.
check out their website.
Thanks, everybody.
Thanks, everybody.
Thank you.
Thank you so much. It was an honor to share time with y'all. Thank you so much.